Okay, this is Hannah Soul Sing's catheter insertion video. There are nothing on the walls to look at or cheat with.
Alright, knock, knock, knock. I'm washing my hands as I'm coming in the room. Hi, I'm Hannah. I'll be your nurse today. I'm gonna shut the door or pull the curtain when I come in to provide privacy. Can you tell me your name and your birthday? I'm gonna look at their wristband as they're telling me to verify, and then I would also check their name and birthday with the MAR and the physician's orders. And then I put the bed to a good working height for me. And now I'm going to pull back your blanket. Before I begin, I would do pericares, and I would just use my clean gloves. So I did pericares. As I was doing pericares, I looked for the urinary meatus so that I'm not searching when I'm doing that, or when I'm inserting. And I'm gonna wash my hands again, and I'm going to open up my catheter kit. Alright, so open, and then I'm going to set this here. I'm going to use this as a garbage. I'm gonna set that here. I'm going to spread their legs. And then I'm going to open this away, side, side, and then I'm going to just use their foot as an anchor. That changes my borders because I want to maintain a 1-inch border for sterility. But since I'm using their foot, that changes sterility. So I'm just going to use their foot as the border. I'll remove my sterile gloves. I'm just going to set them over here. Next, I'm going to use remove the drape, and I'm just going to grab it by the corners. And I'm going to spread it, just grabbing the corners, and now I'm going to lay it between their legs. I'll flatten it out once I have my gloves on. I'm going to take this out, and I'm just going to set it over here because I'm not going to be using that. And then since we aren't using the lube on the mannequins, I'm going to use hand sanitizer. So since that's dirty, it's not sterile, I'm going to put that on before. So I'll just put that in my tray, and then I'll wash my hands. And I'm going to don my sterile gloves. All right. So I also want to maintain a 1-inch border with this package. And I'm going to put on my non-dominant hand first. So grab it by the cuff, and I'm going to keep my thumb up. I want to make sure to keep these above my waist. And then I have one free adjustment, so I'll just adjust the cuff. And now I'm going to put on my second glove, thumb up. And I can touch the whole glove since this hand is sterile. So I want to make sure they stay above. Okay, so then next I'm just going to remove my lube since I'm using my hand sanitizer as lube. So when I throw this away, I'm going to go out and around, and I'm just going to drop it in there so I don't break sterile field. Next I'm going to clean with the iodine. So I'm going to use one Q-tip on the side away from me, and I'm going to go top to bottom. Going to go out and around into the garbage. Next one is going to clean the side closest to me, top to bottom, and then I'm going to go out of my sterile field and around into the garbage. And the last one is for the middle. And I'm going to go top to bottom, out of my sterile field, into the garbage. This also goes into the garbage. Okay, I'm going to move my tray up now, and that flattens out the drape. I'm going to take this out, and I'm just going to put it in the garbage, so out and around. I'm not going to be using it, so it's okay. Next, I'm going to remove the plastic from the catheter. So I just want to make sure that this doesn't go out of my sterile field. So as I'm opening it, I'm being really careful with it. And I'm just going to set this back in the box because the box is sterile, so that's okay. I'm going to go out and around into the garbage. And then I'm going to attach the syringe to the green part, out and around. And before I inflate the balloon, I just want to look and see how much water I have, and I have 10 mils. That's important because I want to make sure I'm getting the same amount out as I'm putting in. So next I'm going to lubricate the tip, and then I'm going to take my non-dominant hand and I'm going to spread, and then I'm going to be careful as I'm inserting because my dominant hand cannot touch any part of the skin or I would break sterile field. So I'm going to insert until I see urine come into the bag, and then 1 to 2 more inches, and then I'm going to clamp with this hand so it doesn't just come right out, and then I'm going to inflate the balloon. And then once I'm done with that, I'm going to pull until there's tension, and then I'm just going to disconnect the syringe. I'm going to come out and around, put that in the garbage, and then I'm going to take my sterile gloves off. These go in the garbage also. I'll wash my hands because I just took my gloves off, and I'm going to attach the Y, and then I'm going to hang this on a non-movable part of the bed, and then I'm going to take my supplies and get them cleaned up. These all can go in the garbage because they don't have blood or body fluids on them, and if they did, they would go in biohazard garbage. So I'll just set them over here, but they go in the garbage. This goes in the garbage. And then I'm going to make sure my patient is comfortable. And I'll get them covered up. Oh, and then since I did clean with the iodine and that stained skin, I'm going to do peri-cares after insertion so that it's clean. Then I would cover them up, and I would make sure they have their call light and that their bed is in their lowest position, and I would ask them if they needed anything, and they don't, and that is how you insert a catheter.